Hi everyone and welcome back to my channel. Today we're diving into a topic that affects millions of women around the world, Polycystic Ovary Syndrome, or PCOS. If you've been diagnosed with PCOS or suspect you might have it, you're not alone. This is a complex condition that can affect many aspects of your health, but the good news is that it's manageable with the right approach. So let's break it all down, what PCOS is, why it happens, and how it can be managed effectively. Hi, I'm Dr. Knapp, family medicine physician here to bring you medical information so you can take control of your health and make the most of your doctor visits. PCOS is a hormonal condition that impacts how the ovaries work. It's one of the most common causes of infertility in women and affects about 1 in 10 women of reproductive age. The term polycystic might make you think it means having many cysts on your ovaries, but it's a bit more nuanced than that. In PCOS, the ovaries might develop many small fluid-filled sacs that can be seen on ultrasound. However, the real hallmark of PCOS is an imbalance in hormones, which cause a range of symptoms. To understand this better, let's talk briefly about what happens in a typical menstrual cycle. Normally, the ovaries produce an egg each month during a process called ovulation. This process is regulated by a delicate balance of hormones. In PCOS, that balance is disrupted. Levels of male hormones, or androgens, are often higher than normal. This can interfere with ovulation and lead to irregular or missed periods. At the same time, insulin resistance, a key feature in many women with PCOS, can further complicate the hormonal imbalance. The symptoms of PCOS can vary widely from person to person. Some women experience only a few mild symptoms, while others face more significant challenges. Irregular periods are one of the most common signs. This can mean fewer periods, longer cycles, or even skipping them entirely. Many women with PCOS also notice excessive hair growth on their face, chest, or back, a condition called hirsutism. This is due to higher levels of androgens. Others may experience hair thinning or loss on the scalp, acne that doesn't improve with typical treatments, or weight gain that can be hard to manage. In some cases, women with PCOS have difficulty getting pregnant because ovulation isn't occurring regularly. But it's important to note that PCOS doesn't automatically mean you can't have children. It just means you might have to take a different approach or get some help from a doctor. Another key aspect of PCOS is metabolic health. Insulin resistance, which we mentioned earlier, plays a big role here. This occurs when your body's cells don't respond as well to insulin, a hormone that helps regulate blood sugar levels. As a result, your body produces more insulin to compensate, which can lead to weight gain, cravings for carbohydrates, and even an increased risk of type 2 diabetes over time. The exact cause of PCOS isn't fully understood, but researchers believe it's likely a combination of genetic and environmental factors. If you have a close family member with PCOS, you may be more likely to develop it yourself. Lifestyle factors such as diet and activity levels can also influence how PCOS manifests, though it's important to remember that PCOS isn't your fault and it isn't caused by something you did or didn't do. Diagnosing PCOS isn't always straightforward because there's no single test for it. Doctors use a combination of criteria to make a diagnosis. These criteria include irregular periods, signs of elevated androgens, either through symptoms like excess hair growth or lab tests, and the presence of multiple small follicles in the ovaries seen on ultrasound. If 2 of these 3 criteria are met and the other possible causes have been ruled out, a diagnosis of PCOS is typically made. It's worth noting that not everyone with PCOS will have visible cysts on their ovaries, and not everyone with ovarian cysts have PCOS. That's why it's so important to have a thorough evaluation, including a detailed medical history, physical exam, and blood work to assess hormone levels. Managing PCOS involves addressing the symptoms that matter most to you and improving your overall health. For many women, lifestyle changes are the cornerstone of management. This doesn't mean a one-size-fits-all approach. Every woman with PCOS is unique, and what works for one person might not work for another. That said, let's talk about some key strategies. First, maintaining a healthy weight can make a big difference for women with PCOS, especially if you have insulin resistance. Even a modest weight loss of 5 to 10% can help regulate your periods, improve ovulation, and reduce symptoms like hirsutism and acne. But weight loss isn't always easy, especially when dealing with hormonal imbalances. That's why focusing on a balanced, sustainable diet is so important. A diet rich in whole, unprocessed foods, lean proteins, healthy fats, and plenty of vegetables can help regulate blood sugar levels and support hormone balance. Some women with PCOS find that reducing their intake of refined carbohydrates like white bread and sugary snacks helps them manage insulin resistance. Meanwhile, staying physically active is another powerful tool. Exercise not only helps with weight management, but also improves insulin sensitivity and boosts the mood. Stress management is often overlooked, but equally important. Chronic stress can exacerbate hormonal imbalances, so finding ways to relax, whether that's through yoga, meditation, or simply spending time doing things you enjoy, can be incredibly beneficial. Lifestyle changes are an important foundation, but they're not always enough on their own. Fortunately, there are several medical treatments that can help manage PCOS symptoms. If irregular periods are a concern, hormonal birth control is often the first line of treatment. This can regulate your cycle, reduce androgen levels, and improve symptoms like acne and excess hair growth. For women trying to conceive, medications like clomiphene or letrozole can stimulate ovulation. Metformin, a diabetes drug, is often used to treat PCOS. It can reduce serum androgen levels, improve insulin sensitivity, restore the menstrual cycle, and trigger ovulation. For excess hair growth, options like hair removal treatments, anti-androgen medications, or even certain types of birth control can help. It's worth discussing all these options with your doctor to find the right combination for your needs and goals. Living with PCOS can be challenging, not just physically but emotionally. Symptoms of PCOS can impact your self-esteem, relationships, and overall quality of life. For some women, the frustration of dealing with weight gain, hair growth, or fertility struggles can lead to anxiety or depression. If this resonates with you, know that you're not alone and that it's okay to seek support. Talking to a therapist, joining a support group, or connecting with others who understand what you're going through can make a huge difference. Taking care of your mental health is just as important as addressing the physical aspects of PCOS. While there's no cure for PCOS, it's a manageable condition. The key is finding a personalized approach that works for you. Over time, you may need to adjust your management plan as your body and life circumstances change, and that's perfectly normal. Regular checkups with your doctor can help you stay on top of your symptoms and address any concerns early. One important thing to keep in mind is that PCOS isn't just about reproductive health. Because it's linked to insulin resistance, women with PCOS are at higher risk for long-term health issues like type 2 diabetes, high cholesterol, and heart disease. Taking steps now to manage your symptoms can also reduce your risk of these complications later in life. If there's one thing I want you to take away from this video, it's that PCOS doesn't define you. With the right tools, support, and information, you can manage your symptoms, improve your health, and live a full and vibrant life. If you found this video helpful, don't forget to like and share it with someone who might need it. And if you have any questions or want to share your own experiences with PCOS, leave a comment below. I'd love to hear from you. Remember to subscribe for more videos on women's health topics, and I'll see you next time. As always, take care of yourself and make the most of your day.